The arm-twisting Jane is getting fierce right now on Capitol Hill as Democratic leaders scramble to find enough votes to pass the health care overhaul. One Illinois lawmaker, though, is fighting back. Congressman Gutierrez explaining his new stand for his district and his country. That's coming up on America Live next.
My next guest was actually a yes vote first time around. He voted for the health care overhaul in the House, but now he says he's opposed to this bill. Congressman Gutierrez of Illinois joins me live to tell me why he's changed his mind. Congressman, good afternoon to you.
Good afternoon, Megan. Pleasure to be with you.
It's a pleasure to have you. So first you voted yes, and now you say you're voting no. Why?
Well, the bill is different. We're going to vote on the Senate version of the bill. One of the things you probably remember, we agreed that undocumented workers, those that are here not under color of law, would not benefit from this bill. I guess you remember when Congressman Wilson said to the president, "You lie." Well, he wasn't lying. But then the president went one step further and said, not only will they not benefit, but even if they wish to use their own money and go to the public exchange and purchase health care for themselves and for their families, that will be disallowed. Even if you're a permanent resident, legally in the United States, you will be required to purchase health care under this program, but you will not be able to benefit from any of the subsidies. We think that if people are legally in this country, working under color law and admitted to the United States, they should be able to participate in the program fully and fulfill all the requirements. And moreover, if you're here undocumented in this country and you want to use your own money so that you don't have to access emergency care, so that you're not a burden on the rest of taxpayers, you should be able to do that and purchase that health care insurance.
Now, I know that you've been talking with the White House about your concerns. This is the issue for you that is withholding your no vote. You've been talking with the White House. Has President Obama or any of the top Democratic leaders in the House suggested to you that there's room for negotiation on this?
You know, Megan, I'm going to meet with some folks from the White House tomorrow. I look forward to that meeting. A couple of cabinet members have called me. We've had conversation. I've spoken to others, to friends and allies. I'm a Democrat. I'm from Illinois. Barack Obama was the senator that I helped put in the Senate and I helped put in the presidency. So we have a relationship. I think the White House needs to move forward. I don't think it's helpful when David Axelrod goes on the morning news network and starts saying that immigration has nothing to do with health care and we shouldn't mix, especially when the president went to the House floor and injected immigration into the debate. They kind of started this debate. We just want to finish it and we want to clarify it.
I mean, if the White House does not bend and doesn't do anything in this bill to change any of your concerns or change the language that speaks to any of your concerns,
then I won't vote for the bill. Then I won't vote for the bill, Megan.
That's clear. You're
firm on that. And they understand that. I'm firm on that. I will not vote for the bill unless the White House begins to address the immigration issues both in the context of the bill and outside of the context in the bill. Look, Megan, there are going to be tens of thousands of people here this coming Sunday on March 21st. I've called for those people to come so that they stop being invisible, so that we can have the president keep his promise to enact comprehensive immigration reform. We're going to be here this Sunday, tens of thousands of us, and I think that this is part and parcel of that struggle and of that fight.
Has anyone at the White House suggested to you that they might change the language to allay your concerns?
Here's what we're going to do. What we're going to do is we're going to have a conversation. What I do, Megan, you should understand, when we went to the White House, what we did is basically laid our cards on the table. The president told us his position and his limitations. We told him our position. We know there's a gap. Now it is time for us to sit down in the coming days. I know it seems like it's such a pressing, but you know, 3-4 days in Washington, D.C. is an eternity. This thing can be resolved in 5 minutes.
But the conventional wisdom when it comes to immigration issues is the president can't take that on right now because there's too much pressure for him not to, and you are putting pressure on from another angle, but the conventional wisdom is that he's not going to do it because that issue's too dicey for him to get into. What's your view on it? Do you think you actually can get some movement?
Yes, and the conventional wisdom during the campaign was that immigration was a winner for Democrats, and Democrats finally carried Colorado, New Mexico, Florida, Barack Obama received over 70% of the Latino votes, and 2 additional million Latinos came out to vote because of the issue of immigration. It was good when he was running for president of the United States. It should be a good public policy issue now that he is the president of the United States.
Well, it's so interesting to hear you say that there's a few days in Washington is like an eternity. We're going to be watching as this next eternity comes down the
Megan,
pike.
I've been here 18 years. You know, so this thing, there is time, and we'll deal with it. Most everything is already agreed to. It's set in stone. It's the nuances we have to deal with, and I'm looking forward to having those discussions. But if nothing changes, I will not vote for this bill.
All right, Congressman Luis Gutierrez, thank you so much for joining us.
Thank you, Megan.
And folks, we'd love to